All right, we're live. We can get started in 5 minutes.
No problem.
All right. I guess we can get started now. Hello, everyone. Welcome back to my medical message. Today, we have a general surgery presentation with Dr. Mohamed Fakih. and he has joined us here and prepared a lovely presentation for us. So welcome to my medical message.
Thank you so much for having me. I really appreciate it. I'm currently a first year dental surgery resident. I'm Dr. Mohamed Fakih. It feels a little weird calling myself doctor, but I've earned this title, and it's a pleasure and a privilege to be called a physician. So my presentation would be on general surgery residency and the obstacles to medicine. I really like to highlight the obstacles of medicine because there are a lot of people that face adversities and failures along the way, and they are a normal part of the process. So I kind of like to illustrate and be real with you guys. So I'll have two Q&As throughout the presentation. I know that there'll be a lot of questions going in before, so I'll address like a couple questions before I begin the presentation, just because I know a lot of you guys are eager to hear responses and you guys have plenty of questions. So let's begin here. So I guess, what prompted you wanting to go into general surgery as opposed to more specialized type of surgery? How does your training prepare you for complications during surgery? So in terms of general surgery, the reason that kind of pushed me in this direction was it's very broad based. We deal with a lot of different population, various population, and we deal with a lot of what we call the abdomen. So there's you have the ability to go into a multitude of subspecialties, as I'll go on to further discuss about the field of general surgery, what makes it unique. So I'll talk about that a little bit later, as to why kind of general surgery versus a more specialized training. How does it train prepare you for complications? Well, we deal with complications on a daily basis. Some are preventable, others are not. So we're able to learn how to manage patients on the floor, as well as how to um, handle adversity and complications that arise. So it's part of our training. It happens whether we like it or not, and that's something how we learn. We learn on the fly and through the mentorship of our seniors as well as our attendings. What is the most intensive procedure that you've performed? So I'm currently only a first year resident, so I haven't performed too many procedures. We typically do more intern level cases. So we do incision and drainages. So people who have fluid collections or abscesses, those who have cysts, like sebaceous cysts, we'll kind of remove them ourselves. So I haven't had anything too demanding as an intern. Have you ever had to change procedures because of issues that arose during surgery? Yes, that does happen. I've had a patient where their belly was completely full of scar tissue, and as a result of that, we were not able to see the belly. It's not a safe procedure, so we had to abort the procedure. So that does happen, not as often, but it does happen. Is there a specific type of procedure or surgery that has become common after the coronavirus? So the coronavirus induces an inflammatory response, and there have been anecdotal responses where some people will have like appendicitis, so inflammation of the appendix. I wouldn't say there's anything particular that occurs. One thing that we do um, place a lot, we help place chest tubes because patients have developed their lungs become stiffened as a result of coronavirus, and oftentimes they may have a deflated lung, and we are consulted to help reinflate that lung by placing a chest tube. So that's something I've noticed I've helped quite a bit while on the service. What is the most common form of surgery performed on a day-to-day basis? Uh, the very routine surgeries, kind of bread and butter three. There's hernias, there is cholecystectomy, so removal of the gallbladder, and appendicitis. Those are the big three, I would say, big surgeries we perform as a general surgery resident. What are some of the main tasks you do in a day? I'll discuss that later. I will talk about a day in the life of myself later on. Do you have to work in an outpatient department, or do you have to do any procedures? So as a surgery resident, I'll talk about later on as well, but you're primarily inpatient. So you're in the hospital, not outpatient, although we do clinic once, twice a week. So that's something at outpatient. It's a couple more questions before going on the procedure, but before going on, how has COVID-19 affected your work? It's a very good question. Initially, the COVID-19 virus affected us because it would lower our case volumes. A lot of cases that we do or what we call elective cases. And as a result of that, they're done as a scheduled, as needed basis. So they're not really emergent where they need to be done right away. So those cases were actually declined and postponed because of the coronavirus. So to more urgent or emergent procedures that need to be done that day or within a few hours. What do you think is more important for general surgeon to work well with other physicians in a surgical team? I think you need to be teamwork oriented, be able to take criticism and feedback. Those are two big things I think make you really well rounded and work with the team. Also, communication skills. I think medicine is, as much as any other field or any career path, communication is very vital, important. Um, the root of many medical errors or issues happen at what we call the sign out period, where we hand off patient. So if I have a patient, I sign it off to the on-call team. A lot of the issues occur because of lack of communication. So communication, I think, is a very big important key. I'm going to continue on to kind of go to the my presentation, but I'll answer more questions as they come along. Great questions so far. So the journey to become a general surgery resident, the triumphs and failures. As I mentioned before, I want to highlight both the good and bad, because I think a lot of individuals you'll see on social media or from others is the good, and I think there's a lot of learning you can learn from the failures as well. So I'm at the Detroit Medical Center in Detroit, Michigan. This is my base hospital. This is who I am, Mohamed Fakih. So just to meet me, I am a first-year general surgery resident, currently in Detroit. I'm a graduate of the Wayne State School of Medicine, which is also located in Detroit. While at Wayne, I served on a few different boards, one being the admission committee member. So I played a pivotal role in admitting students that matriculate into medical school. So I have an understanding as to what criteria is needed for students to matriculate, what qualities we look for. I also was an executive member of the Arab American Medical Association and a founding member of the Healthy Hearts organization. I'm very proud of that. Our goal for this organization, the Healthy Hearts, was to increase healthy habits one habit at a time, because I think cardiovascular health is very important and linked to high mortality and high death rate in surgical patients, but non-surgical patients as well. So I think it's something really important to our overall well-being. Interest that I mentioned, is I love the kind of the higher acuity setting, so urgent care versus trauma care. I also have interest outside medicine, so I love sports. I have business interests, so I have interest in commercial real estate. The reason I kind of include that is because you spend most of your time dedicated to the field of medicine. I think you need to have outside hobbies, outside interests, outside the field. They're good for being able to decompress and de-stress, as well as to live a nice work-life balance. And I think that's important to me. I strive for have a ideal work-life balance. However, in residency, it's not always the case because you work a lot of hours, but that's something I'm trying to take into account when I do become a full-fledged physician. So some hobbies that I mentioned, I said one of them is commercial real estate, so business. I love the opportunities that it provides, the freedom it provides, but also just kind of the ability to connect with people. I'm a big sports fan, as I mentioned before, big Kansas City Chiefs fan. My girlfriend, fiance now, she is from Kansas City, and so we love our sports, especially the Chiefs. They won the Super Bowl 2 years ago, and unfortunately, they didn't win this year. They lost to Brady, but I'm a big sports fan. I think it's a way for me to decompress. I also did Arab folk dance when I was in undergrad. It's a way to kind of a creative form of expression. I loved it. It's a great exercise and a great teamwork, as well as bonding experience. Even then, during the pandemic, I'm an entrepreneur at heart, so I find creative ways to find solutions, and I find ways to make money. I enjoy that. So I did work as a DoorDash driver and Instacart driver during the pandemic time. So I picked up food for others and delivered it. It was a lot of fun, actually. So I think people talked about kind of why did you choose general surgery? Here I can highlight as to kind of things that really appeal to the general surgical field. So general surgery itself is a very, very broad field. It includes a lot of organs or surgical procedures in the abdomen. So the gallbladders, pancreas, a liver, um, your small bowel, large bowel, colorectal, and that's what makes you in general surgery very unique. Is you have the ability to subspecialize in multiple different fields. One being plastic surgery, vascular surgery. You can do cardiothoracic, so like open heart surgery. So these people who get cabbages, a triple vessel disease, they'll be seen by a cardiothoracic surgeon. You have hepatobiliary, so you have the ability to work on the liver and then the hepatic and the biliary tract. Transplant surgery is also subspecialty, so you can do the liver, kidney transplant. Um, is a subdiscipline of general surgery. Colorectal, so you can deal with anything in the low rectal region. You can do ICU, critical care medicine, or you can do trauma surgery. So very wide scope of practice, which is one of the appealing reasons for the field of general surgery for me. Now, is it for you? If you enjoy a high-paced environment, the ability to quickly treat patients, and you're on there on the brink of life and death, such as in trauma surgery, um, this is a field potentially for you. There is also a ton of procedures. So as you can see here in this picture to the right here, this is a female surgeon working with an attending, and she's utilizing a cautery device to to surgically use electrical cautery to kind of cut a piece of organ. So if you love working with your hands, you love tons of procedures, the ability to place chest tubes or central lines, this is something I feel like can be very appealing for you. Another thing that's very appealing for this field is the fact that there's the instant gratification. I had a patient the other day that had their gallbladder removed, and she felt immensely better afterwards. So, um, the ability to see your work and see the product of your work immediately after is a very rewarding aspect of this field. You also love the bright lights. You're going to be in the operating room for 89 hours a week while in residency for 5 years. You got to really enjoy being in the operating room. There's a lot of sacrifice that goes into this field, but if it's something you enjoy, you'll push through. And you also have high impact. I think regardless of what field you choose, what career path in the field of medicine, you're going to have a high impact. But here in the field of surgery, sometimes, like I said, patients are life and death, and you have the ability to save patient lives right in your hands. Now, to talk about some of the benefits I talked about before: instant gratification, you have the ability to help people, there's the ability to fund procedures. And one cool thing you have about the field of dental surgery that's advancing now is you can see it right here. This instrument you see in the picture is what we call a Da Vinci robot. No, it's not a robot that controls itself, but it's not seen here. But you can see in a um, different part of the image in this room, there's an individual kind of playing like a video game, manipulating using his hands to manipulate the robotic device and perform surgery. This is a really cool procedure. You see in the console 3D image of the internal body where the camera is focused on. So it's as if you're playing a video game, performing robotic surgery. So that's one of the kind of few benefits, many benefits in the field of general surgery. Now, some of the cons. I think we focus a lot of time on like, oh, this is very rewarding. It's high impact, good instant gratification, but there's also detriment to it too. You have high stress. It's just you're dealing with patients that are life and death. You're gonna see people that unfortunately pass away. It's long hours. You're working anywhere from 70, 80 hours plus a week for 5 years. So it's a long track. It's 4 years of undergrad, 4 years of medical school, and then 5 years of residency, and then plus or minus 1 or 2 years of fellowship. So if you add that up, it's 4, 8, 13, somewhere between 13 and 15 years, including undergrad. It's a long time. You're also on call for 24 hours at a time, usually every 4 days, up to 28 hours. So that can be very stressful itself. You deal with a lot of poop. I think I mentioned this because I think sometimes people are a little hesitant to poop. I know it's natural, but they can be very hesitant to it. You work nights, weekends, and holidays, especially during residency. Sorry about that. I'm actually post call, so I was on call overnight yesterday. But you do work at odd weekends. You split holidays, so you have that. You're gonna be working on days where it's a lot of times usually family time for other residents, and there's a lot of liability. You have the patient's life in hand, and some people are very sue happy, so you have sometimes uh, increased liability as a result of being a general surgery. Now, I think someone talked about like what's a day in the life. So here I kind of go break down a little bit what a day in life is as a general surgery resident. Typically on a non-call day, you'll typically sign out by 4 or 5 p.m. So it's still about a 12-hour day, or sometimes 11, 10 to 12-hour day. Yeah, I typically wake up 5 to 6 a.m. between that time frame. Arrive at the hospital about 6:30. Sometimes even a little earlier, depending on how the day is. Sometimes we'll start rounding at 6:30. So I'll get to the hospital about 5:30. I will then pre-round on my patients. What does that mean? So pre-rounding means that I go around, I check on the patients, check on their vitals, check on all the labs, check on anything overnight, call the on-call team to do all that, um, and then gather an assessment on the patient based on these findings, so we can plan out the day or plan out the next step for this patient. Then we typically go around with our attending between 7 to 8 in the morning, and then from 8 to 10 and beyond, it really depends on your tasks and duties. Sometimes you'll be on the floor, so you'll be responding to pages, answering the consults, whereas sometimes you may be helping with notes. Other times you may be staffing or seeing other consults, or prepping for the upcoming cases for the day. And then between like 8 to 9, 10 a.m. to about 3, 4 p.m., we'll operate, we'll answer pages, we'll see new consults in the emergency room or in the hospital. We'll also reevaluate patients just to make sure that we're not missing anything and that the patient is progressing in the right direction as we expected. And then about 4 to 5 p.m., that's when you sign out to the on-call team. And this is where I talk about a skill that we need to kind of hone a little better, is that sign out. Um, um, Sign out during the day where a lot of communication errors happen. That's what can be a very big root cause of miscommunication. Now, I'll break it up right now here, and I'll go over a little Q&A. My first of two. So I'll answer some questions while here. So I guess I'll move on to these questions. What is the most difficult surgery? I don't think it's necessarily in terms of patient or the actual, not a patient, sorry, the actual procedure. It There are very technical procedures that can be done very easily if given the proper guidance and direction. Other times, simple procedures themselves with too many ports or too many access can often lead to making the procedure that much more difficult. What is the process of becoming a general surgeon? Who would be best for general surgery? I think I mentioned that before I discussed it, but the process is 4 years of undergrad, 4 years of medical school, and then 5 years of general surgery, plus or minus 1 or 2 years of fellowship if you pursue that. Who would be best for general surgery? I think I mentioned before, ambitious, those individuals that want to go to the operating room, who wants to dedicate their lives here. Those are the people that will be best suited for general surgery. What are some new technologies that coming up that benefit especially? So there's always an advancement, and I think robotic surgery is becoming more and more utilized in this field. It typically was before done in bariatric surgery, but there are surgeons that are using the robot more often, and they'll be able to bill for it more as a result of that. So how does your schedule? That's a very good question. How does your schedule differ from residents that specialize in something other than general surgery? I think if you're in the inpatient floor, you do typically work 70, 80 some plus hours of work a week. Where I think I know the medicine team, they do like, I think an outpatient ones, they do Monday through Friday, so they get Saturday, Sunday off, which is really nice. So you will never really go over the 80-hour work weeks. I think that's the biggest difference. They may take less call than us, That's always possible. What do you enjoy most about residency? I think it's the people. So who you spend it with um, is what makes residency a little more enjoyable. No, I think it answers. But what are some paths you can take after residency? So plastics, transplant, hepatobiliary, cardiothoracic surgery. Those are all can be put into options. Why did you pick a surgical path instead of a non-surgical path? So I think I am a type A. I'm a person. I need to be doing something. So if I'm just sitting and doing nothing or thinking too much, it's not that's not who I am. That's why I chose the surgical path because we are very effective as decision makers. We stick to a plan and put into action. Whereas I think the medicine team tends to, not necessarily a bad thing, they tend to dwell on every single detail, and that's just too slow for my brain. I'd be zoned out, zonked if I listened to every detail. Someone asked, "What is a highlight of your job as a nursery resident?" I think being able to see and be for patients that are very thankful for us helping them out is very rewarding, and is makes their job a little that much easier. What are some key qualities you look for when admitting students to medical school? So I think that's a very good question. Empathy is one. Two is the ability to take criticism and constructive feedback and use it to become a better person. I think it's a very, very good quality because you're gonna make a lot of mistakes on your journey. I've made my fair share of mistakes, and I think being able to learn from that and apply that has immensely improved my uh, reach. Yeah, that's a question. What process do you follow when examining a patient with a deformity? So I think the big important thing here is I know it's a patient with deformity, but use a systematic approach. So follow the same things you do beforehand. Um, and usually I do what I do is I usually do head to toe. So I start head, make my way down to the feet and the lower extremities. So I know I didn't miss anything. Would you say that field has changed in recent years with more advanced technology? I think it's more minimally invasive surgery. That's where the key path is. Doing more IR guided, not biopsies, but um, more emphasis on wellness, I would say. I'm gonna leave these these questions for the next Q&A, but I really appreciate you guys all asking very thoughtful questions. Am screen sharing now?
Yeah,
Okay, just making sure. Okay, perfect. Um, So my next part is I think talking about the journey. I think this is a very important lesson, just because it's not always about the destination, but how you got to the place and being able to treasure moments through the ups and downs. So I highlight my journey through here. So I did undergrad at the University of Michigan in Ann Arbor. Um, I took pre-med classes. I also majored in something called biopsychology, cognition, neuroscience. It's called BCN. It's a psychology degree with a small emphasis concentration on biology, and I really enjoyed it. Actually, a good, interesting story is um, I almost actually went into the field of neurology because I liked so much of the aspect of what they do, and not necessarily about neurology, but in the psychiatric field. So, any exposure I can get to that, I think was really important to me. Medical school is 4 years at Wayne State School of Medicine. I had a broad experience, very culturally diverse population, so it made it where I was able to kind of function transition well into medical school. Residency is a 5 year program. I'm in year one as a preliminary resident. Um, so I've helped out and maintained uh, everything you do as a first year resident. So I'm
I
doing
think
so far.
we can only see your Q&A screen right now. Is
Oh,
that, oh, there it is. We see the family
oops, sorry.
medicine screen.
Oh, oops. Yes,
There.
this is my journey. Sorry again. So here, this is kind of outlines the pathway to general surgery residency. So it's 4 years of college, 4 years of medical school, then 5 years of residency in surgery. Kind of highlighting other fields. So pediatrics is 3 years, internal medicine is 3 years, anesthesiology is, I believe, is 4 years. Um, Emergency medicine is 3 years with the ability to fellowship. They all have fellowship opportunities. All surgical fields are 5 years. I think with the exception of, I think, plastic surgery and vascular surgery, there are some direct programs that are 6 years. Some are 5 years. They're very, very, very competitive. Derm is 4 years. Most are 3 to 4 years primary wise, and then if you want to specialize, again, it's another couple of years. So I think one thing I want to talk about is failures in medicine. Their failures themselves are inevitable. They're gonna happen regardless if you like it or not. Um, it's hard in the moment to really use these failures as a learning experience to grow, but they're very important in your stepping stone to success. I think they can oftentimes be blessing in disguise. I've had at times where a failure on my part led to some great opportunity down the line that I would never gotten otherwise. So I think if you keep that half glass full, more positive mindset, you'll see failure as something that you want to seek rather than kind of avoid, like most individuals do. Now, I talk about one failure. It's my first semester in undergrad, and I took a second organic chemistry with 17 credits load, so it was very demanding. And I thought I felt good because I was like in high school, I was killing it. I got 3.8. I'm chilling. I'm doing good. First exam gets rocked. 52. I saw him the score 52, and um, it really hit me hard. I was like, man, do I want to drop this? Like my school offers a drop without a documented record. Maybe I should just use it here. Um, we kind of looked with my parents and we kind of decided, hey, we're going to push through this. And I ended up doing really well on the next exam. And I think got like an A and like 92, 93. So it was an A, big jump from like a DF. Um, and things I learned from this experience is like being open and change your study habits. But I think being open in general. So being open and being willing to have a discussion and talk to someone about a certain topic, I think is very important. And also asking for help when struggling. I think that's what I didn't utilize initially. And I asked help after the exam rather than kind of during it. So I think it's really important. So being proactive and asking for help when you need it. Now, that's kind of going over failures in medicine. Um, Talk about the MCAT. I think this is a big beast that a lot of individuals kind of face every mile, every whatever part of the year. And in my circumstance, I took it 3 times. I was trying to take it before the change, so you can see both scores: my um, old MCAT score, and my percentile, and like a new conversion rate. So I was hovering over the 50th percentile when taking the MCAT before studying completely, and I think I jumped up 7 points. I think what this taught me, this failure to medicine, is not never give up, but also every failure has the ability to turn into something that's good, and you can use this opportunity to improve yourself. So this investor, one of the investors that I'm aware of, um, apologize. Um, uh, One person during one of my interviews, like I asked, like, how did your MCAT score jump so much? And I said, I think the practice exams really all added up, and I was able to score significantly better on those exams than previously noted. And I think um, it's a combination of things. I think fluids, eating, drinking, those all can play a role, I think, in the long run. Now, going over failures in residency and feeling overburdened and inefficient, I think um, you may see residents kind of carrying pagers. They go see a patient. They're getting push and pull in 10 different directions. So um, oftentimes as you can see in this picture on the left hand side, someone's trying to show him paper, someone's trying to show him a phone, someone's trying to give him a pen. They're all trying to make him do something, and you as a person, you only have 24 hours a day. You don't have the ability to clone yourself. Well, I think you can, but um, clone yourself. So uh, I think it's important to understand and acknowledge when you're feeling overburdened or inefficient. What did I learn from this experience is making a checklist of all tasks I need to complete and checking off as you go. Um, prioritize tasks that are needed to be done more immediately. So if this is a more elective case, I'll bump myself to the more emergent case that is going to go back today or within a few minutes. And then also, the other thing I learned is multitasking is inefficient. You only have the ability to work on one task only. So opening yourself up to multiple tasks, multiple browsers does not really help at all in the long run. So the next thing I want to talk about is imposter syndrome. This is kind of the euphoria of feeling like a phony, like you this moment you got to this point based upon sheer luck, not necessarily based on your hard work. And examples may include like I don't deserve to be called Dr. Mohamed Fakih. Well, I mean I earned it. So it feels weird to call myself doctor, but I just earned this task. I got in medical school just by sheer luck. It's another imposter where you feel like it's all due to external circumstances, not necessarily um, um, like just sheer luck. Then perfectionist, so you always have a perception of that you have to be perfect, and if it's not done perfect, you have to be redone. But not everything in life is perfect, so ability to show them, showcase that studying can be not necessarily flawed, but it can also lead to um, uh, it can lead to many friendships too. I think that's one thing I learned in the field of medicine here in dental surgery in Detroit. Now, how do you deal with this? So I think one is sharing your feelings, so being vocal. Some people are very hesitant to share, so they may not share it specifically. Use social media more moderately. Social media itself has grown and changed over time, becoming a little more business oriented, but a lot of individuals are claiming themselves as individuals here in on social media itself too exactly. Um, and I think being able to share and use social media, because social media can be very a ground where people compare themselves to others. So you looking happy versus me looking sad may appear like I'm sad, but in reality, internally, I'm doing very well. Lastly, refuse to let it hold you back. I think be able to overcome it, as I think Kobe mentioned in his book, um, most recent book about him and his celebrity coach that's worked with him. Now I'm gonna go over some case studies. I think it's very important, not very important, but these are interesting because these are cases that patients that I've encountered with similar clinical symptoms at all, and we'll kind of go over and break them down. So, if a 30-year-old male presents with 2 weeks of intermittent history of chills and subjective fevers, he also has reported shortness of breath. ED physician put him on 2 liters of nasal cannula to help him breathe. Patient continued to increase difficulty of breathing, and we got a chest X-ray for tomorrow. So in this case, he's more short of breath, more oxygen requirements. What do you think could be going on in this individual? Uh, that what could be causing a shortness of breath intermittently occurs? So in this case, this individual had what we call a pneumothorax. These pictures kind of really illustrating the severity of pneumothorax. So you can see here on the right hand side, all these white lines here. They go all the way to the corner edge. So that's how you know the lung is properly inflated. If you look on the left side of the picture, it's all clear here. So this is all the lung that's kind of not collapsed in this patient. So this individual needs something to relieve this tension pneumothorax. What could we do to relieve this pneumothorax if you know how we treat it? Okay. Asthma, pneumonia. So this individual, they need a needle decompression. So they're along their axilla line. So you look at the axilla, midway through. You go to about the fourth, fifth rib, and you go over the top of the rib. The reason you go on top of it is because you want to avoid any damage to nerves, arteries, and veins in that region. So you may cut off blood supply to um, the other collaterals, but it has collateral um, circulation, so that it's able to, even if you clip one of the arteries, it still has other flow from the other arteries. So this individual, hopefully, he has recovered after his um, PE, pulmonary embolism study. Second case we have. So this is a 55-year-old female presents with severe pain in the right upper quadrant or center abdomen that radiates to the right shoulder or back. She's tender on physical exam over the abdomen when touched. Symptoms that she has is fever, nausea, and vomiting. In this case, what do you think is going on? What could be causing her right upper quadrant pain in this case, based upon her history, her age, all her symptoms? So in this case, yeah, so she had tenderness over the abdomen when touched. She had fever, nausea, vomiting, and then, sorry, I didn't mention this, but what type of imaging setting should we do for this patient that has this kind of right low quadrant pain? It's her to palpation. She only has a white count of like 10. Should we get an ultrasound? Should we get a CT scan? Should we get a CAT scan? Should we get an MRI? What do you think we should do for this patient? Yes, ultrasound is definitely a choice. So in these cases, especially if they're female, one thing you also gotta ask if the patient's also is, are they pregnant or do they plan on becoming pregnant? Because a lot of times that can impact how you approach a situation or how you handle um, the babies for future outcomes. So in this individual, we did get an ultrasound. I can go to it. We did get an ultrasound. And if you look on the left side, this asks the gallbladder, and because it's necrosed, it actually turned green, but it's a huge and thickened wall on this ultrasound. He also has some free fluid, and then he has some stone. Sorry. So, there's two big causes of gallstones or gallbladder disease. One being here in the cholecystitis, and the other is in other surgical interventions that may require the bowel using. So you can see this dark gray is very thickened. Here's the free fluid surrounding it, and then here's six-stranded stones. So kind of take a message here that I want to talk about is medicine itself is a long journey, but it's worth it. So don't feel pressure or rush, knowing you have to do know what you're doing in life. Trust the process, learn from each failure and grow. Experience many failures as failures. So that's something I think a big point is there. You don't forget your support system. I got you through medical school. It's a whole new ballgame in residency, but I know most people will be prepared. I'm gonna open the floor to Q&A. I think a second time, and I'll open it later on too, just for other individuals that have questions that want me to answer as well. Very good question. What high school extracurriculars did you do or recommend for an aspiring physician? I was in my pre-med club. I don't think it was that helpful early that on. I would honestly do things that you enjoy. Like if you love piano, do piano. If you love football, do football. If you like lacrosse, lacrosse. If you like to knit, do knit. Do things that you really enjoy, and your time will fly, and you'll enjoy it more. What high school extracurricular activities do you recommend as a no? Oh, someone asked about um, how what is the hardest case that you were part of? I think one I was part of, I think, was an exploratory laparotomy. This individual had a mid big line cut. We took a look in there, and um, unfortunately, we opened this individual up, and he realized he didn't have any mass or lumps or bumps, so we weren't able to do the procedure completely. And someone asked me to take gap year, so I took a pseudo gap year. So I did about I graduated half semester, whole semester early. Plus, I had 3 to 6 weeks of like paid vacation, so I really had almost like a half year, a half a year off. What are you taking gap years? I think if it's necessary, if you don't have the skill experience, you don't have enough clinical exposure, then I would do the Q and A with the or the not the Q and A, but I would do the study here. Switch. There it is. Okay, that is it. I'll answer any more questions people have. Let me see. Have you ever lost a patient? Yeah, I've lost a few. Um, Sometimes it's really hard because you lose a patient and then you have to go see the patient other patient needs right away. So you learn how to develop like a filter system of what you want to talk about that day with your significant other, and um, that's how you kind of be able to kind of take on gap years and transition that all. How do you maintain your motivation in the competitive field? Um, it's hard sometimes. Sometimes you need to push through the days to get a good result. Others are not. I think what motivates me is the ability to have freedom and also the ability to perform procedures on individuals and be able to see my work take into action. And that's my biggest uh, takeaway from there. Trauma and general surgery go hand in hand. Typically, the trauma surgeries will take any type of vehicle accident, even if it's scrape or bruise. Um, they may not operate on it, but just to offer some tamping off the bleeding. So the requirements for being a team, or just most time now is vaccine is the biggest rollback we're trying to get. We have over I think 3 million individuals that have gotten the vaccine, and majority of them are older adults, which is a great sign. But we need to get everyone involved. I think the COVID vaccine is taking individuals that are really young and making them really sick. It shouldn't be in the opera. It shouldn't be in the ICU. I feel like I've answered a lot of questions. Does anyone else have any further questions? The last couple minutes, we'll get the uh, platform off and we'll continue on.
We'll just give them a minute to put in a few more questions.
Sure. Oh, how was your experience on the mission team? That's a very good question. I really enjoyed it. So I actually interviewed over 100 plus applicants. And here's my favorite part of the day. And a lot of the individuals, so the way my school structure is, there is a long portion with the faculty. So you do like 40-minute interviews with them, and then you have multiple mini interviews. So they have built-in stations that you can rotate with different faculty, and they grade you there as well. And the last thing, we have like an outpatient month, I think, or like a letter vacation month, and that's where one of my friends is getting married during that time frame, um, because it's a much lighter schedule. I think when you're on the inpatient service, you're working 70, 80 hour weeks. When you're on the outpatient in the clinic, 40, 50 hours max. What qualities you look for as an admission officer? I think I talked about it before, but hardworking, perseverance, um, willing to learn, and be able to take feedback. How long does residency last? So my residency is a 5-year residency. I mentioned before a few others. Plastics is 5, vascular is 5. So there's general surgery is 5, whereas urology is still a 5-year residency, plus or minus 1 or 2 year fellowships too. What major do you need to be a general surgeon? You can be any major you want. That's the beauty of it. You can be a major in anything. Uh, marketing, finance, anything you do. That's what gets you interested in the ultrasound. What major you need to be a general surgeon? You can be any major. You can be art history, medical design. Just go take the prereqs and move on and apply. I don't plan on doing a fellowship at all. There's always a possibility I may change my mind. So I'm always open to new things. Yes, there is ability to take a gap between medical school residency. A lot of people do. Sometimes what people do is they'll get into the medical school, they'll forfeit their application, open a slot for someone else, and then the other individual can kind of slide in the next class. Can you specialize? Yes, you can. So I think I mentioned before, there are multiple subspecialties you can do. You can do plastic surgery with another 2 years, vascular is another 2 years. Um, you cardiothoracic surgery is like 5 years. Um, anyway, but yeah, I think most subspecialties you'll be doing another 2 years, and you will be have the ability to perform those procedures. Is there a specific reason you have chosen dental surgery as opposed to other fields? I don't know. It's one specific reason. I think I just enjoyed the field when I was on medical rotations.
All right. That seems like that's it for questions. Thank you so much for joining us and for your presentation. We definitely learned so much from that. It was really nice to have a surgeon on our platform. I think you're the first surgeon to be on our platform. So thank you so much for joining us. And for everyone else that's still watching, I posted the link to the Google form for your shadowing hour in the chat, and that will be due by 8:30, which is when it's going to close. So thanks again for joining us today.
Thank you for having me. Appreciate it.
Have a nice day.